Fox and Friends, 23 minutes now past the hour. Well, a 21% pay cut looms for doctors receiving Medicare patients, and that may force physicians to scale back on the senior patients they treat, even drop them from the program altogether. Our medical A team is here, Doctors Mark Siegel and David Samadi, to tackle some of these big stories of the week. Nice to see you guys.
Good to see you.
Dr. Siegel, you penned a piece in the New York Post this week specifically about this, that if they were going to see this 21% decrease, these pay cuts, that doctors would be fleeing all over the place.
Even without the 21%, Medicare's in trouble. You know, they hold it out as a great Medicare, but I got to tell you, I get the same $50 a visit for seeing a patient over the past 10 years at a time when my office expenses are up 30%. Now, my old patients come in, they have longer lists of problems, longer lists of medications I'm giving them. I'm keeping them alive longer. I have great technology, great pills that I can give them. But the problem is, Medicare is not really accounting for that. It's also allowing my patients to come in unnecessarily. It's also cutting unnecessary tests. If I want to send a patient to a great prostate surgeon like Dr. Samadi, they may not allow it. Medicare is not sensitive to the medical needs of the physician.
And this is also hurting, it seems, it could hurt the elderly more disproportionately because you have these doctors who aren't able to see these people anymore.
Well, you know, it's very interesting because exactly what Mark said, these curves, as patients are living longer and longer, these two curves, the cost versus the Medicare reimbursements, are going to get wider and wider. And that's as a result of actually what we've done in the past, and great medical doctors and cardiologists that have been able to save and prolong life,
right,
which was always good. But now they need to basically fund this. They need to fund and take care of the doctors so they can take care of the patients. And it's going to be a problem. And, you know, I can tell you most physicians, this is only about their patients. They care about their patients. They don't want to walk away from Medicare because this is a great job. This is not, you know, this is...
But you have to live, and that's the problem.
Exactly.
And if you're not getting paid appropriately, you've got expenses as well.
Office expenses are zooming up. Reimbursements are zooming down.
Let's talk about prostate cancer, a big story this week in the world of cancer research. And the American Cancer Society has revised their screening guidelines on Wednesday, now saying that most men at 50 years old now should go get a screening. It used to be in the 40s, right?
Well, if you go based on American Urologic Association, we still recommend getting screened at the age of 40. Why? Because any screening has pros and cons and has risk and benefits. Through screening, you may find certain cancers that may not be dangerous. At the same time, you're going to find those lethal prostate cancers that can affect a 42-year-old or 45-year-old. So if you're going to have a limited resources and you don't want to fund this kind of screenings, it makes more sense to make it open between 40 and 50 rather than go after 75, 80-year-olds.
It's the art of medicine, Clayton. In other words, I'm only as good as what I know. This isn't the days of bears and knives and skins.
So you're saying, what you mean is if I'm a patient of yours and you have a screening to look at that I'm 40 years old and you've looked at, that gives you power to make a recommendation.
Exactly. That's when I should sit down with my patient and say, what do? You don't sit down before you have the information. You have the information. Also, the treatments are a moving target. Because doctors like Dr. Samadi can get out there and once they have a prostate cancer can have better results than ever, get the patient out of the hospital the next day, get them back to their job, I'm more likely to want a prostate operation than I used to want one. It's not only about death rates. The American Cancer Society is making a huge mistake here. It's about quality of life, and I can only work on quality of life if I have the information.
You've had a lot of angry patients, too, who have been younger, who have not reached that 50-year-old mark.
It's very interesting because it's not uncommon to see a lot of young guys in their 40s, early 50s in our schedule. And, of course, their cure rate is excellent. They have great quality of life. As far as continence and sexual functions, that's a past tense, and they're doing very well. Yes, they were upset that they're calling saying that had I not gone for my PSA testing, I may not be here for a few years. So this is a very important, and if you're listening to this show, get your PSA test, and that's a baseline. That's a platform where we can follow this over time.
So bottom line, get it. Even if you're not 50 years old, get it when you're 40 and continue to get it.
And then you can sit down with your doctor and discuss that information.
We got to talk about this other story. There's another big story this week about diet. A lot of people struggle to try to lose weight. Well, now DNA could tell us about how to lose weight.
Well, you know, it's related to the same thing. It's about the art of medicine, personalized medicine. You can can get a swab in your cheek, and it'll tell you whether you're going to lose weight on a low-fat diet or whether you're going to lose weight on a low-sugar diet. I looked at this study very closely. It's very, very interesting. It's only about 100 patients they looked at. The genome is just being unpacked, but this is the wave of the future. 5 years from now, we're going to be able to swab your cheek and say, Clayton, you're going to lose weight on a low-fat diet. Clayton, you're really the father of that child. You know, we're going to be able to do that.
Oh, good. That'll be good. 10 seconds on that.
Well, I like that. I like this study because, number one, it's not a very expensive test. It's only about $150. And this can actually play a big role in everything we said. If you swab a patient and find out if they have a lethal prostate cancer versus a low-risk prostate cancer, there you have it. You've saved billions of dollars, and I like this study, and I hope it develops to be something really serious.
It won't be covered under Obamacare, though.
Well, of course. Both of you doctors, I love having you on, Dr. Siegel, Dr. Samadi. What we'll do here on Fox and Friends is why don't we try to get this test, we'll do it as a segment here over the next coming months, and maybe we can test and see how we all could possibly lose weight. All right.